More flu cases are popping up here in the U.S., and now new research out of the U.K. shows being hospitalized with both the flu and COVID at the same time could double your risk of dying. Tina Kraus has more in today's Medical Minute.
After COVID restrictions around the world nearly wiped out the flu last season, the influenza virus is back, and for some, it's a double whammy.
I think if you're unlucky enough to get COVID and flu at the same time, what our evidence tells us is that you're at markedly increased risk of severe illness.
Researchers in Scotland, England, and the Netherlands studied more than 300,000 adults hospitalized with COVID within the last 2 years. Nearly 7,000 of them had COVID along with another viral infection. 227 patients had both COVID and the flu. And Professor Kenneth Bailey says those patients were in the most danger.
We found that if you have COVID and you also test positive for flu in hospital, then your risk of dying is doubled and your risk of needing a life support machine or a ventilator is quadrupled.
1, 2, 3.
Doctors say because both viruses like to attack the same part of the body, the throat, behind the nose, and down into the lungs, testing for the combination is crucial.
I think the important message for doctors is we should test patients in hospital for both COVID and flu.
As both viruses circulate, researchers expect the mixed infection to become more common and say anyone offered vaccines against COVID or the flu should get them. Tina Kraus, CBS News, London.